Well, Gakuru, I just want to thank you again for agreeing to do this interview. It's mainly just kind of a follow-up to see how you have been doing. Obviously, you understand dialysis, you understand kidney health, and all of the work that you have done now. And you and I have communicated for well over 10 years. Have you noticed that there's been kind of hesitation from different kidney health organizations about dispersing information, education to just the general population?
Well, there are several challenges to. Thank you so much initially for inviting me for this interview. And it's true, we've been talking about renal health for a long time. And personally, being a kidney patient, I have the reason why we started the Kidney Research Kenya in the first place was because we found there was no enough information, there was no enough doctors and nurses in Kenya, whereas I live in the UK, that could take care of the patients and people with renal health. So the experience of going through dialysis and seeing the challenges that go along with the kidney patients in many ways brought about great interest to trying to do something about it. And because we started from what we call the first principles, and what I mean by first principles is by I would say probably knowing nothing about renal, and then teaching ourselves what we should do, and finally being able to get started and start the organization and bring into formation that we have today, that we have trained over 78 health renal specialists in different countries, in different organizations. And coming to your question, I would say I thought I will get what I would say a very friendly hand from where I sit in England regarding the work we do, especially abroad. We've never been lucky enough for this, except for institutions that we work with and doctors that have been my mentors and also carers in many ways, my own very renal nephrologist doctors and nurses that have made the journeys that we've made today. But as per institutions, and we have several of them in the UK that deal with renal health, whether it's Kidney Research UK or Renal Association here, we have not had much help. And therefore, that's why it resorted us to going all over the country. I've been to the US, I've been to other places to try and find what help can we get to help us with the work that we do.
Gakuru, let me ask you a question. Do you think that it's that the people who, say, have the financial and the intellectual resources to assist, is it that they just have no interest in helping? Is there government red tape, as they say, involved? What is your opinion about why there's not as much assistance?
Well, I understand that there might be local issues, which one would understand. For example, maybe the jurisdiction of every funding most times is restricted to a certain geographical area. Subsequently, probably The ones in the UK, they don't want to venture outside UK. They just want to take care of the kidney patients in the UK. And others, I would imagine that they have the same restrictions. We have very few international organizations that deal with the kidney diseases per se, overall, or even improving it. What I've found is that in the UK, institutions will be willing to help. But again, if you're coming to something that we do, which is training doctors and nurses, they will still want to ask for revenues and tuition and other things like those ones. And sometimes they just decline straight away. We can't do that. But we found helping hands elsewhere in our quest for this. And that's probably just the attitudes that are around some places.
I think also it's important for people to understand that we'll be viewing this interview, that it's great that there's so much interest in artificial intelligence and maybe incorporating artificial intelligence mechanisms as a way to help further along research experiments without actually having to tamper with human bodies. But the problem is there is a significant increase in people around the world, particularly those that are uneducated about the wellness of kidney health and how the kidneys really do impact the overall, body. Do you think that with all the research and all of the methods that are being conducted, I just want to look at Kenya and just look at Kenya, for example, do you think that the education about kidney health is starting to be dispersed more effectively over in certain countries within Africa?
When we started the campaign for Kenya, especially 2008, 2009, I would say we started the first rural renal clinic in a hospital called Kikuyu, probably about 20, 40 miles from Nairobi. That was the first renal center outside Nairobi as a rural clinic. And we had a lot of difficulties in setting it up because Nairobi, which is the capital, held all the specialists, held all the resources that are required, and they also didn't want to license anything outside what they could control. So we had quite a few fights in one way or the other to make this happen. But as I speak, then we had a conference in 2015 that brought Americans to Kenya from Toledo University. And that conference, I think, sparked something in the psyche of politicians and people who make decisions. We invited everybody, including the ministers. And talking in 2025, I would say that there are over 43, maybe even 100 renal centers in Kenya. So within a span of what I would call 15 years, we've had an explosion of something that didn't exist, becoming part of clinical and important therapy for renal patients in Kenya in a big way. When it comes to AI, it is essential that it's used where it is and available, especially in the Western countries. But there is a lot that still need to be done in the developing countries, even before we think about AI. The initial one is actually collecting data about the renal health, about causes of renal failures, about the geographical positions that we should be effective for renal centers to be started, about the best way to dialyze the patient, whether it's PD or HD or any other way. And not just that, but availability of clean water to help with the dialysis. So we are, I would say Kenya probably is maybe another 10, 15 years away from AI becoming a part of their living. But it's important in collecting data. I think that will be very useful as a tool, and especially on a few renal centers that might be available, that the little information that they may have, they might be stipulated to mean a bigger picture in the areas that these centers are. However, with institutions in the West that would be interested in doing research or even establishing their own renal centers, and developing country like Kenya, that environment, that situation can be available, I believe. And subsequently, the AI would be relevant in such situations because it will start from what I call the first principles. They will come with it and then implement on the ground as they grow. But that is something that has to be, it's an issue of wait and see.
When it comes to having clean water and adequate and I guess nutrient dense foods, are there any nonprofit or even for-profit organizations that are volunteering to make sure there's I'm not sure. I'm not really sure about the environmental structure over in Kenya, but I don't know, is there some type of aquifer or are there any ways that are engineered to make sure that clean water can be given to citizens of Kenya and making sure that nutrient dense foods are available for Kenyans?
The reality is that, well, having been born there, I've never thought for a minute that the issue of nutrient dense food has ever been an issue. The issue has always been, what do the locals know about what they're eating? I think it's about the what I would call nutrition information. Because you'll find somebody who has diabetes, because the normal food would be something like what they call ugali, which is powdered maize meal, or maybe what one would call thick porridge, with very nice vegetables that are available. They will still take it. And white maize with is not good for diabetes and subsequently not good for kidney patients, or it will increase the preference of kidney disease in a region based on the food that somebody is taking. But we have been taking some of this education back to the village, telling people don't eat so much starch. Try to minimize the starch and increase your vegetables. So it's not an issue of nutrient rich because the food is available in most places. Kenya is quite agricultural in many ways. The issue is about knowledge and the traditions that we've had for many, many years, and changing it to fit a balanced diet and also choosing the right thing to eat at the right time. When it comes to water, the problem is not availability. The problem is purification. Now, that's the challenge, because if you are doing dialysis, you've got to make sure that your water passes through several filtrations before it gets to the dialysis to qualify to be equal to dialysis machine usage, first and foremost. And the second thing is to be used by the patients, the renal patients, as they dialyze, because of bacteria and other things, impurities that might be in the water. So purification process would be the challenge. Setting up a purification plant, for example, for a dialysis unit, would be a challenge because of where they get their water. However, as time is going by, I think there are quite a few improvements. PD is very far from being a reality, as probably second or the third way of dialyzing, especially in the rural areas. And the simple reason being the sucrose fluids that are used on PD. Very difficult to get because they are controlled or produced by very few companies, and the cost is also exorbitant. And subsequently, for those who would like to participate in it, I think the doors are open. We are here to facilitate because of our many years working in Kenya, especially on renal, and also the networks that we do have within Africa to make such a thing happen. The other thing that is also very important is education, whether it's nutrition issues, whether it's dialysis, especially to patients that are using dialysis, because despite all the efforts, the little efforts I would say we have made compared to the challenges that kidney patients face, there's still a lot of education that needs to happen to the patients, number one, to the service providers, which is huge. Because in the process of dialysis, somebody may pass on because the operator or the user has not maybe connected the patient properly, or even they don't know what size of dialyzer they need to use, or they are not actually doing proper diagnosis for the patient, or even observations while the patient is dialyzing. All these little observations and medical knowledge that is required to make a kidney patient comfortable while dialyzing, have the proper bed, proper machines, because that's also a big issue when it comes to maintenance and other things like those ones. And also the availability of the necessary kits for dialysis, whether it's the lines or the needles or the fluids that you need to use, or the wipes and bandages, anything that one needs to use while dialyzing, is not readily available. And also iron and EPO that sometimes patients need to get from time to time. These things are not available. So the opportunities are many for those who would like to try it. The other thing that I think is important is to find organizations that would, in quotes, expect less and do more for the patients. And those might not be many, I know, I'm just saying out there, because everybody expects when they give, they will receive from another hand elsewhere. And sometimes that might not be very possible in a place like Africa, where sometimes there are a few other challenges even before we get to the dialyzing position. The last one is obviously, which most people know, is poverty. There are patients that might not even have enough money to go to a hospital or even to take themselves to a hospital, and they may be lost in between. And it's not lost in us that we have a huge population in rural areas that may not have heard even about dialysis in itself. So there are quite a lot of challenges, but again, it's progressive. We can't say we are where we started in 2008. There's more awareness now. There is more knowledge. There are people who, with internet and YouTube and TikTok and Facebook, the information is flowing slowly, and people can Google or find information from the internet and probably find an easier way to do it. The last one that I would like to talk about is kidney transplant, which I am a recipient. I would say it's a huge challenge in the area. For example, the largest hospital in East Africa, which is Kenyatta National Hospital, does less than 50 transplants a year. And when we brought the Americans from Toledo, at that time, Professor Lees and others who came with us, 9 of them, was to start a center for transplant in the region. The problem is when you do the maths, there's nobody wants to touch it because there's no much money to be made. But there was a formula that they had used that could work, but there's a lot of commitment from other institutions, and also the willingness to do it sometimes lacks, because if there's no government to government kind of connections, and most times when this comes into place, then there's still other challenges of some people wanting to keep more money than they provide the service. So there's a lot that still needs to be done, but we are there, so we're still pushing. Currently, we have a few doctors and nurses we are taking to China. We're just waiting for a few letters. Previously, we've had doctors coming to the UK. We have had doctors going to the US. We have had doctors going to Egypt. So we have a few partners around the world that have helped us. And we want to say we are very, very, very grateful, because without them, the 78 doctors and nurses that have been trained through us would not be taking care of thousands of patients that they do every day. And thank you very much for
And
Jenny.
so, what a lot of people want to know is what they can do to improve their health where they live. So, if you could give a message just to the public around the world, what message would you like the public to know about your endeavors, your work, your research, and where you see things progressing, maybe even in the next 5 years from now?
So there's a lot that still needs to be done, but we are there, so we're still pushing. Currently, we have a few doctors and nurses we are taking to China. We're just waiting for a few letters. Previously, we've had doctors coming to the UK. We have had doctors going to the US. We have had doctors going to Egypt. So we have a few partners around the world that have helped us.